Good evening and welcome back to A Day in the Neighborhood. Tonight we will be talking about a very important issue for all of us, healthcare. Tonight we have a very special guest, Robert Stevenson from Single Payer Now. He is a spokesperson for this association, this organization that has been advocating very hard for healthcare. Welcome, Robert.
Thank you, Myrna, for inviting me.
Oh, it's a pleasure. Now, your association, Single Payer Now, would you tell our audience what it is about and what exactly are you advocating?
Okay, we're advocating single-payer healthcare, which means the same healthcare system we have now, but with only one payer, one insurance company, which would be a state insurance plan that would cover everyone.
Okay.
So right now in California, there are something like 6,000 different entities that are responsible for handling health insurance costs.
Right.
Different healthcare payers and plans and everything. Blue Cross alone has 1,200 plans for California. And this creates a huge bureaucracy. It also creates a huge cost. About 1/3 of every dollar we pay in this country is spent for administration.
Mm-hmm.
And single payer would simplify that whole system by creating a state health plan. So there would be, if I got sick, I would go to whatever doctor I go to or any hospital, and I would take out my California health card and show them the card. There would be no copay, and I could have the same care that I'm getting now, and everyone would be covered in the whole state. So that's what is actually provided for in the bill written by Sheila Kuehl,
Right.
called Senate Bill 840.
Exactly.
Senate Bill 840 was passed by the legislature 2 years ago and was vetoed by Governor Schwarzenegger. It's being voted on again this year in the legislature and will most likely come again before Governor Schwarzenegger, and will keep coming back until we finally get it passed.
Now, what would you anticipate another veto by the governor?
If he acts true to form, yes, he probably will. Even if he had passed it 2 years ago, right now the insurance company would have mounted a referendum to have everyone, vote, and they would spend hundreds of millions of dollars on television ads to try to get people to vote it down, because their bread and butter depends on the present system. They're making out like bandits.
Now, tell me, with this single payer, a hospital like Kaiser Permanente, who also is an insurance provider, how will that impact them? How will they exist in this scenario?
Well, Kaiser is both an insurer and an HMO and a hospital system. And they're actually probably one of the most efficient systems. They would certainly do very well. What Senate Bill 840 and any single payer plan would do is reduce an enormous amount of bureaucracy.
Exactly.
give you an idea, 1/3, about 30% of the healthcare workforce in this country consists of administrators.
Right.
And in order to get an idea, Carl Sagan used to talk about the universe as being, so big you couldn't understand it. It was all billions and billions of stars. Well, it's hard to get an idea of how large the health insurance bureaucracy is in the same light. But if you go to your doctor, in the doctor's office, they probably have 2 people responsible full-time just for handling health insurance claims.
Right.
And in a hospital, you can imagine how many people they have. They have rooms full of people doing nothing but healthcare claims. The insurance companies have rooms full of people doing nothing but healthcare claims. And what is single payer? That's single payer.
Wow.
We reduce the bureaucracy. We already have single payer health insurance in the form of Medicare, in the form of the Veterans Administration, and their administrative overhead is a tiny fraction of what it is for the country as a whole.
Now, how would that impact Medi-Cal? Medi-Cal stay, right?
Yes. Under the Senate Bill 840,
Right.
the Sheila Kuehl's Universal Health Care Bill, everything that the government is paying now, Medicare, Medi-Cal, all of these programs, will simply be folded into the health care plan. Either the U.S. government will just pay into the plan directly, or they will continue to pay the plans as they do now, and the money will just sort of come side by side with the money from the health care plan, the California Universal Health Care Plan.
Now, is this a very innovative form of dealing with healthcare? Has this been tried in any other state in the country? Or is California the first?
California is the first state. It's not very innovative, though, because every other industrialized country in the world has a national health care plan with essentially single payer. Canada certainly does too. What happened in Canada was one province, I think it was Alberta, adopted a single payer health care plan, and the other provinces initially were skeptical, but when they saw how much money Alberta was saving, they all joined the bandwagon.
Exactly.
And now Canada has a national health care plan.
How much will the state save? I mean, look, Schwarzenegger is laying off people, and we have a serious deficit. So this would be a likely scenario for resolving that deficit.
It certainly would be. There was a report done about 4 years ago by the Lewin Consultancy, and they estimated that the single-payer Senate Bill 840 would save about $30 billion a year in California.
Wow. That's a lot. That's a lot. So in other words, if you look at it like a mirror, then it's the insurance companies that are losing $30 billion if we're saving that much.
Well, the insurance companies, a lot of people, 30% of the workforce, are employed shuffling papers.
Exactly.
And if Senate Bill 840 had been law and we switched overnight, you would have an enormous amount of people that would no longer have a job.
Right.
So recognizing that, the Senate Bill 840 has provisions to retrain all these people to actually contribute to health care, to become healthcare providers or or nurses or doctors or medical technicians or whatever, instead of just being administrators.
Now, so in other words, under the single payer health care, how do you determine that amount? Is it by person? Is it by income? How do you determine that?
You mean, what would it cost?
Right, exactly,
yeah.
exactly.
Well,
like say a family of 4.
Okay.
2 working family, and maybe they make, what, 60,000?
It would be funded the same way that the present healthcare system is. You would have employer contributions and employee contributions.
Okay.
So until the bill actually gets through the legislature,
right,
the numbers can change slightly, but it's roughly 12% in the present bill.
right.
12% of payroll would go to pay for the health care.
And for small businesses?
And I believe at present it's the employers would pay 7.5%, and the employees would pay 4.5%. So typically, if you're on the low end of the income spectrum, this would save you maybe $100 in bills. If you're on the wealthy end of the spectrum, it could be a larger savings. But most important is you would no longer have pre-existing conditions.
Okay.
You would no longer have co-pays. You would no longer have expenses that were not included.
Wow.
And so this would cover health, it would cover dental, it would cover eyeglasses, it would cover mental services. It would even cover some alternative medicine treatments, acupuncture and things like that.
And for people who do not have income, it'll be...
If you don't have income, you still have the health care card, you just don't have to pay for it. So if you're self-employed, then I believe you would pay the 12%, the employers and the employees share.
Okay. Now let me ask you, in terms of form, why, given that this bill has been vetoed by the governor before, and even if it passes both houses, the likelihood of getting vetoed is great, why not just put a constitutional amendment or something that would make the voters choose this, so that the insurance companies say cannot come back and introduce their constitutional amendment? Is that something that...
Almost certainly it will come down to a statewide referendum anyway, because whether the bill passes in the legislature and gets through the governor
right,
or doesn't, if it passes and becomes law through the governor signing it,
right,
then the insurance companies are going to have a referendum to annul the bill.
but they would have to convince the voters that it's a bad idea.
They would have to convince the voters. But they have so much money that they could run television ads all day long,
right,
on every channel.
Yeah, but if
probably will.
Yeah, but what I'm saying is, it's an excellent idea. I mean, healthcare is a major concern, not just for people who can afford it, but for everybody. So in other words, the likelihood of voters saying, hey, this is a great idea, we want to vote for it, it is pretty high. So why not just go that route?
Well, we did that in 1994, I believe. And initially, voters were strongly in favor of a single-payer bill. But then the insurance company outspent the supporters of the bill by about 40-1, and in the end, the bill passed only in San Francisco and Berkeley.
Wow.
And was voted down in all the other counties.
With the exit polling on that, what was the key issue? What was the key concern that the voters had at that time that made them vote against it? Do you know?
Well, do you remember Hillary's health care bill and
Yeah.
the
Yeah.
commercials about that, Thelma and Louise?
But I think that at that time, though, isn't it all about timing as well? At that time, because I remember that distinctly, but I think that at that time it was a new concept, and people were confused, and the insurance companies and all the other opposing associations were able to confuse the public. But 20 years later, maybe it seems as though
you'd hope we've learned by now.
Exactly.
But still, if you're opposing some kind of change,
right,
then all you have to do is make people afraid of
change.
What would happen? You'll lose your choice. It'll be socialized medicine. It'll be, more expensive. It'll be more of this. It'll be less of that. And you hear this all day long, and some people start to think so. So what we're trying to do at Single Payer now is inoculate people by talking to people, person to person, writing letters, meeting people on the street,
build a
talking to
movement,
them, and building a movement
exactly
to inoculate people against this kind of poisoning their minds before it becomes a referendum.
Good strategy.
I mean, the healthcare system is a train wreck in slow motion.
Yeah, it's working.
And it's not sustainable. Everything is going to blow up in a few years anyway. And the testimony to that is that everyone is talking now about their health care bill. It's a few years ago it wasn't a major issue. Now it is.
Especially with the baby boomers, right?
In a few more years it's going to be the only issue.
Exactly.
But since 2000, wages have gone up 20%, but the cost of healthcare premiums have gone up 87%, and the cost of the employee contributions for healthcare programs have gone up 150%. And so that's from 2000 to 2008. And wait a few more years, and how much are we going to be paying for health care? Already we have 1/6 of the people in California have no health care plan because they can't afford it. And many of the others have a health care plan that is really useless because they have huge copays or they have limits to the coverage.
Or some people have like huge deductible, to keep the cost of the premium down.
$5,000 deductibles, things like that. And so healthcare problems are a major cause of bankruptcies.
Exactly.
And it's only getting worse because the costs are escalating. We pay the highest cost of any any industrialized country, of any country in the world for that matter.
Exactly.
$7,000 is about twice what people in Canada or Switzerland or France pay. And yet we have, of 21 industrialized countries that were surveyed by the Packard Foundation, the U.S. was last in every category of about 7 different categories, public health and so forth. And according to the World Health in 2000, in the 2000 study, we were ranked 31st in the world in terms of quality of health care between Slovenia and Costa Rica.
Wow.
And so that's where we are. We're a third world country in terms of the quality of our health care, but we pay more, twice as much, as any other country. And that's because we have the most inefficient system we could possibly have.
Exactly.
It's a patchwork quilt that just doesn't make any sense.
Exactly. Now, where are the presidential candidates in this? Senator Obama and McCain.
Well,
how do they perceive this?
They're both talking about health care, which I
Right.
suppose is progress of a sort, but neither one is supporting single-payer health care. There is a U.S. bill, House Resolution 676, which is essentially identical to California's H.R. Senate Bill 840, rather.
Oh, really? Okay. Who introduced that?
It's John Conyers of
From-
Michigan,
Oh, wow,
Democrat of
okay.
Michigan. And but neither presidential candidate supports the Conyers bill, and in fact, Nancy Pelosi has not come out to support it either.
Really?
So the Obama plan, he's basically talking about universal health care, but it just means what we have now, only more of it. And it keeps the insurance companies in the picture. They remain middlemen.
It's a big business.
Because it's big business, yeah.
Exactly.
And they're big contributors to campaigns. That's the reality. And John McCain's healthcare program is essentially what some people call yo-yo healthcare. Y-O-Y-O. You're on your own.
Clever.
Healthcare is a universal human right.
Exactly, it should
was
be.
declared a human right. It was actually, it goes back to Eleanor Roosevelt, I believe.
Okay.
And it's on the list of the UN's list of human rights. And everyone should be entitled to health care.
Exactly.
But
exactly.
that's not the system we have. By having a statewide health insurance plan, the state can save money in many ways. First of all, it can negotiate with the drug companies and the medical equipment providers and get better rates. So that saves money. It cuts out the bureaucracy. That saves money. It can put more emphasis on primary care.
Right.
Right now, people that don't have health insurance, and there are a lot of them in California, they don't go to a doctor until they get really sick, or their kid is really sick, and then they take their child to the emergency room, and that's the most expensive kind of healthcare delivery that there is. An emergency room is very expensive. If they had health coverage and could take their child to a physician ahead of time, not only is it less expensive as a form of treatment, but they would treat the illness sooner and probably prevent a major crisis later. I mean, the reality is that our present health care plan, by the health insurance companies insuring the well and avoiding the sick, this is making people sick.
Exactly.
And it's actually killing people.
Exactly. It's like, the bank won't loan you money when you need the money.
Exactly.
They'll only loan you the money because you can pay and you don't really need it.
Yeah.
Yeah, same thing.
It's the same story.
Well, it's been a pleasure talking to you. My God, this is such a major subject. Every day look at the paper and there's always some kind of discussion or coverage on healthcare, and people, there doesn't seem to be that kind of solution that this single payer healthcare presents. So good luck and great work.
Well, thank you very much. And before I leave, just read the sign on the back of the shirt.
Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Dr. Martin Luther King. Awesome. That's true? Oh, that's better.
Don't move. Are we done?
That's
Can
good.
we shut down everything? Okay, we're done. Don't run with your microphone on.
Thank you.